and welcome to Good Life, the health show with me, Puja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle, and much more. Well, viewers, children often complain of pain in the legs but have otherwise no restriction in their activities. And what causes it? Is it normal? These are some of the questions which comes in everybody's mind at this point in time. So to discuss on this, we have with us in studio Dr. Sukalyan Dey, Consultant Pediatric Orthopedic Surgeon. So not to waste any more time, I'll straight away move to him and talk more on the topic which we have taken today. All right, thank you so much, Doctor, for coming to Good Life, the health show. So in the nearly next half an hour, we are going to discuss on the topic which we have taken, that is children often complain about a certain kind of pains, aches and pains in children's leg. So these are some of the problems, or these are some of the issues which is being faced by every children, or maybe many kind of parents are also complaining about this. So if we start with children often complain of pains in legs. So what would be the first thing you would like to start at?
Yes, as you said, that's a very common phenomenon, almost an universal phenomenon. And it is also called growing pains, as the name suggests, because the cause has been attributed to a very rapid increase in the length of the bones, and that causes a stretch in the bones, and that is supposed to cause the pain. So the pain typically is in the later hours of the day, evening, after especially a very busy day at school or at in the ground, and the child usually complains of pain.
Okay.
So this is a very trivial kind of thing in the sense that it doesn't cause any long-term effects. The only thing is that the parents or the child might be a bit concerned because of the pain.
Okay.
And all that is required is just a few massage, or maybe a bit of lukewarm or hot fomentation or compress, and sometimes over-the-counter drugs might be required.
All right, doctor, so which is the age group we are talking about? Like, which is the age group?
It can occur throughout the childhood, but the incidence is more during the growth spurts. That is, these are the phases of rapid growth during a child's childhood, when the bone grows very, very fast. And it doesn't cause any problem. Even the child doesn't remember it the next day.
Okay, so we see no restrictions in their activities. Activities go on and on. So if in that kind of time, like how the parents will come to know that my child is in pain, so I have to immediately act upon it. So what would be the signs and symptoms you would like to tell about it? That if you see any like a deformity in your children, what kind of things a parent should take a note of it?
That's a very good question. So just like my job is to see patient, your job is to bring out wonderful informative programs. Children's only job is to play. So a playful child is always a healthy child. If the child stops playing, if he frets, if he is not very communicative, if he is avoiding such kind of activities, or if there is any swelling, any tenderness at any point of the bone, if there is any redness, if there is any fever, that means something more sinister is going on, and a consultation from a specialist is required in that cases.
So if the regular activities is seen as something fishy in that activities of a children, so the parents might have to know that something is wrong with the child, and they should immediately act upon it. And if the symptoms, if we talk about it, will there a swelling be seen in the child's leg if a pain emerges? So what would you like to tell on that?
So the things which are not growing pains can be either an infection or it can be an injury. In either case, there will be fever, there will be redness, there will be swelling, and all other things that the mother or the parents would come to know that something is not right, because the growing pain usually eases off with time.
All right, doctor, now let's talk about the legs of the child which appears curved. Is it normal? Let's talk about bow legs. So if bow legs, knock knees, and what is all about that? We also have a clip on that. So if that picture will be a clarity for the viewers, and if you would like to put some light on that.
That's right. Yeah. So just like every person is unique, so every person's legs and their lower limbs and upper limbs and all parts of the body are unique in a sense. So they come in all shapes and sizes. And what's more, throughout the life of a child, until their growing phase ends, the legs undergo a continuous change. For example, from 0 to 2 years, their legs remain outwardly bowed, and which is called a bowed leg correctly. From the age of 3 to 6 years, their knees are bent the other way around, and we call them knock knees. And from 6 to 11 years, they more or less go on achieving the adult alignment of the limbs. So if their appearance is under a wide margin of the normal limits of the population, then we don't worry at all, because it's just a normal phenomenon that the child is supposed to outgrow.
Okay. So bow legs, knock knees. So if it is found in any of the child, so we can say it is normal. If it is, we can see the performance or the activities are normal in the child, isn't it? So is there anything to worry about if the parents are concerned?
Yes. So provided it is within the limits of normal measurements, then it is perfectly fine, because the child is supposed, this is a normal phenomenon that every child undergoes.
Okay.
Okay. But if it crosses the measurements, or if there are some red flag signs, such as the appearance is only in one leg, okay, then it is a cause of concern.
Okay.
And having said that, there are also some of the diseases which might be hidden inside all those appearances. The commonest being the rickets, which is due to vitamin D deficiency, and that also causes such kind of deformities.
Okay.
In those cases, where there is an underlying disorder, the deformity, instead of getting corrected, will worsen with time. And that is one of the red flag signs that the parents must consider and bring them to a doctor.
All right, so it is always better to act upon fast whenever things are seen as something messy is done, or if you find that the limbs or the legs are not same, so you should act upon it fast as possible. Okay, now if we talk about, some children also have flat feet. Concerned parents, they always have a talk about this also, flat feet, but can perform all kind of activities normally. So if we talk about the flat feet, what is it all about?
Yes. To tell you an interesting thing, we all are born with flat feet, just that we achieve the adult alignment and the arches appear as we grow up. In 9 to 25% of children, the flat feet persist, but at the same time, if it is flexible, if it doesn't cause any activity restriction, then it is a normal thing in the population. Just like some people have curly hair, some people have straight hair, so some people have arched feet, some people have a flat foot. Okay, and that's why it doesn't require any kind of treatment. In fact, those children who have flat feet are able to perform some activities more than others, and they are very flexible. They can perform gymnastics, martial arts, and dance more than the others. Maybe someday they can grow up as a world-famous artist and sports person and bring medals for us.
So there is nothing to worry about it. So does it like cause a long-term problem? Is it something like that about it?
If the feet are rigid or if it is causing any pain, then we should really be concerned, because in those kind of cases, which are quite unusual, but they can cause some problems.
All right. So if it is rigid, or if there is some kind of pain or some kind of irritability, so what is the process, or what is, as a doctor, like what would you like to suggest the parents what they should do at first?
Okay, so there is a very simple test that parents can perform themselves, and the picture of it is on the screen. Okay, if the person can stand on the tiptoes and the curvature of the foot develops, then there is nothing to worry about.
Okay.
But if the curvature doesn't develop, that means there might be some bony deformities, or some bones may be joined together. We call them tarsal coalition. Okay, these are the problems that might creep up. And in those cases, of course, an orthopedic surgeon's concern is required.
All right, so flat feet is done. So, and also we have seen that some children are born with deformities. So if we talk about the deformities also as a surgeon, what kind of like improvement, what improvement can be done in this deformities process, or you bring in their lives?
Okay, I'm so glad that you asked this question, because deformity, especially the musculoskeletal deformities and inborn errors, okay, these are very sensitive medical and social issues. And unfortunately, so much of the misinformation, taboo, and stigma are associated with them. So one common misconception is that the person might need a big surgery, or it is of no use going to the doctor, or it is incurable, or it is a curse, it's a divine curse from the gods up above. All those things need to be dispelled, because most of the children with deformities, okay, they can be completely cured with treatment, and treatment doesn't necessarily mean it's surgery. Suppose on your screen is a child with a clubfoot. So this clubfoot can be corrected. I have corrected more than 2,000 children with clubfoot deformity only with plasters.
All right, so more than 2,000 children you have already cured with clubfoot.
Yes.
Okay.
That's right.
Okay.
So in most of the cases, big surgeries are not required. Even big expenditures are also not required, and they can be 100% corrected. And many of my children are already playing football, they skate, they dance, they play, they do martial arts, they do all kinds of activities. They have started acting like a normal children. In fact, they are normal children.
Okay.
There was just some little bit of glitch in there, and that we have corrected, and they are up on their own.
That's really encouraging for the viewers out there, because they might have some parents or some person have found such kind of things, and they also have found, but there is nothing to lose hope. At this point in time, there are surgeons like you, so they can cure things like deformities also can be cured, but it is upon the treatment process and how the treatment process is being taken up, how the things are being taken up, isn't it? So if I would like to ask you, doctor, if any kind of child, if any such child comes to you at first time, so what is the first process is being asked by you to the parents, that what kind of test is being done, what is the process, overall process about it?
Whenever the child comes, we have to take a history of whether such deformity runs in families, because sometimes we get some of the problems which run in families, and then we can get alerted about not only about this child, but also about the successive children that can be coming in the future.
Okay, doctor, we'll talk about this, but we have a phone call waiting, right. So let's take the caller first. Hello.
Hello, মই আপোনালোকৰ প্ৰগ্ৰামটো চাই আছো, খুব ভাল লাগিছে চাই, বহুতখিনি কথা জানিব পাৰিছো। মোৰ একচুয়ালি ৰিগাৰ্ডিং দিস টপিক মোৰ কোৱেশ্চন নাই, কিন্তু মোৰ এটা জেনেৰিক কোৱেশ্চন আছে। মোৰ বেবি বয় আছে, তাৰ বয়স হৈছে 10 মান্থ। সি এতিয়া মানে নধৰাকে অলপ থিয় হয়, কিন্তু বহুত সময় থিয় থাকিব নোৱাৰে। আই থিংক কেইদিনমানৰ ভিতৰত খোজ কাঢ়িব চাগে। এই যে পটককে বহি যায় আকৌ থিয় হয়, ইজ ইট নৰ্মেল মানে খোজ কাঢ়িবৰ কাৰণে?
ওকে,
থেংক ইউ, আপুনি প্ৰশ্নটো সুধিলে। ঠিক আছে, খুব ভাল লাগিছে আপোনাৰ বেবি 10 মান্থছৰ, আৰু যদি সঁচাকৈ লাহেকৈ থিয় হ'ব ষ্টাৰ্ট কৰিছে, তেতিয়াহ'লে ইটছ এ ভেৰি গুড থিং, বিকজ তাৰ মাইলষ্টনছখিনি একদম ঠিক সময়মতে হৈ আছে। অ'কে, চ' বাচ্চাই নিজে নিজে লাহে লাহে মাইলষ্টন পোৱা বা খোজকঢ়াটো আমি গাড়ী ড্ৰাইভাৰৰ নিচিনা তুলনা কৰিব পাৰোঁ। গাড়ী ড্ৰাইভাৰৰ লগতে গাড়ী ড্ৰাইভাৰ প্ৰথমতে যেনেকুৱা অকণমান প্ৰথমত ৰাইট হেণ্ডত ষ্টিয়াৰিংটো বেছি লয়, লেফ্ট হেণ্ডত বেছি লয়, তাৰপিছত এক্সেলেটাৰ হেৰি কৰে, ঠিক তেনেকুৱা তাৰ সৰু এটা শিশুৰ ওচৰত তাৰ নিজৰ বডিখনৰ এটা গাড়ী নিচিনাই হয়। অ'কে, চ' প্ৰথমতে সি নতুন ড্ৰাইভাৰ, চ' নতুন গাড়ী চালকৰ নিচিনা প্ৰথমত অকণমান চেষ্টা কৰিব, তাৰপিছত মাজে মাজে পৰি যায়, আকৌ থিয় হ'ব। মোৰ হিচাপে আমাৰ এক্সপেক্টেশ্যন হিচাপে নেক্সট 2-3 মাহতে আপোনাৰ বেবী ধুনীয়াকৈ আপুনি যেনেকুৱা কৈছে খোজকঢ়া আৰম্ভ কৰি দিব।
All right, thank you so much for putting that question, and I'm sure you must be benefited with the answer just a doctor gave you. So this is actually a concerned mother who have just asked a question. So this is the thing which is being seen in motherhood as well. So doctor, we were talking about the patient or the child which comes to you with deformity, and the parents had lots of hope with you that what can be done, what are the preventive measures, what is the first thing to do. So what is the lineup? Just if you would like to tell about it.
Yes, so we do a very comprehensive physical examination of the bodies that as you said at the very beginning, that so that we don't miss out any of the points, okay, and if there is something hidden inside. So sometimes we take the help of imaging methods like x-rays or CT scans or MRIs as and when required, and then we come up with a treatment plan. So a point in this context is very important, which is the sooner the better. Catch them young.
Okay.
Once we catch them young, then the dose of the treatment, whatever surgery even that is required, even the dose of the surgery is very much reduced. If we see them later in the childhood, one thing is that the child loses on his childhood, which comes only once in their lifetime, and also the deformities and the correction might become more difficult for us.
So is surgery required for all kind of deformities, or is there any other process as well, doctor? We'll talk on that, but we have to slip into a short break. All right, viewers, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching A Good Life, the health show with me, Puja, and we are having a fruitful discussion on different kinds of aches and pains in children. So, Doctor, coming back to you again, we were talking about the process and the treatment of a deformity child. So, what was the other points you want to mention at this?
Yes. So, with the advance of medical science, we are able to see and look for ourselves, diagnose many of the deformities and inborn errors when the child is inside the mother's womb even before birth.
Okay.
And that is called an anomaly scan, which is performed by the gynecologist, and very aptly so, they have been able to find out very minute problems in the baby itself.
Okay. So that is initially being done.
That's initially being done, and
during pregnancy.
Yes, it is. So if the deformity is very major or it is uncorrectable, then sometimes termination of the pregnancy might be required.
Okay.
But if it is something like clubfoot, which we can always deal with a great deal of success, then we encourage the mother to carry out with the pregnancy, continue with that, and when the child is born, we resort to the treatment.
Okay, so we'll come to that treatment part. We have a caller waiting for us. Hello.
Hello.
আমি শুনি আছো আপোনাৰ প্ৰশ্নটো কৰিব।
হয়, মানে কি আছে মোৰ ল'ৰাটোৰ বয়স হৈছে অলমোষ্ট 4 years। তাৰপিছত সি মানে কি হয় পৰি থাকে বা সি ভৰিয়ে কিক মাৰি থাকে, কিক মাৰি পেলাই সি বহি আছে ক'ৰবাত দুখ পালেও সি তাৰমানে কি হৈছে নেকান্দে, সি পেইনটো ৰেজিষ্ট কৰে। এতিয়া ভৰিত দুখ পাইছে যদিও আমি সেইটো আমি আৰ্নিকা বুলি কয় এটা হোমিঅ'পেথিকৰ এটা হেৰি আছে, অইনমেণ্ট আছে, সেইটো মই লগাই দিওঁ। এতিয়া সেইটো আমি আচলতে গম নাপাওঁ যে সি ভৰিৰ ভিতৰতে দুখ পাইছে, হাৰ্ডিতে দুখ পাইছে নে ক'ৰবাত কি হয়। সেইটো কাৰণে আমি কিবা বেলেগ ধৰণে এক্সট্ৰাকে প্ৰিকশ্যন বা তেনেকুৱা ধৰণৰ কিবা ল'ব লাগিব নেকি ডক্টৰৰ কনচাল্ট?
অ'কে।
আপোনাৰ ল'ৰাটো আছে যে সি যেতিয়াই দৌৰে তেতিয়াই পৰি যায় নেকি, না মাজে মাজে খেলি থাকোঁতে সদায় কেতিয়াবা পটককৈ পৰি যায়?
পৰি যায়, সেইদিনাখনো পৰিছে। তাৰমানে সি পৰি পেলাই সিটো চকুৰ তলত দুখ পাইছিলে। সি কন্দা নাই আচলতে, সি কন্দা নাই, কিন্তু কলা পৰি গ'ল জেগাটো, আমি আৰ্নিকা লগাই দিলোঁ। এতিয়া ডক্টৰৰ লগত আমি কনচাল্ট নকৰিলোঁ, আচলতে সেইটো পিছত কিবা এটা পেইন হৈ আছে আৰু বিশেষকৈ সৰু হৈ থাকে কাৰণে সি পেইনটো আচলতে বুজি নাপায় নেকি, সেইটো কাৰণে মই আপোনাক সুধিব বিচাৰিছোঁ। ডক্টৰ কনচাল্ট কৰিব লাগিব নেকি?
ঠিক কথা কৈছে। চ' আমাৰ শিশুসকলৰ যে বিষৰ সহনশীলতা, ঠিক আছে, পেইন চেঞ্চিটিভিটি যে আমি কওঁ, ঠিক আছে, এইটো চবৰ বেলেগ বেলেগ। কিছুমানে অকণমান পৰিলে কান্দি দিয়ে, কিছুমানে খুব বেছি জোৰকৈ আঘাত লাগিলেও তেওঁলোকে নাকান্দে, তেওঁলোকৰ সহ্য শক্তিটো বহুত বেছি থাকে। তো সেইটো পেৰেণ্টছ হিচাপে আমাৰ এটা কৰ্তব্য আছে, আমি যদি সঁচাকৈ ক'ৰবাত ফুলিছে, ক'ৰবাত ৰঙা হৈ গৈছে বা ক'ৰবাত তেজ ওলাইছে, তেতিয়াহ'লে ঘৰুৱা ট্ৰিটমেণ্টখিনি আমি দিব পাৰি, যিখিনি আমাৰ ড্ৰেছিং কৰিব লাগে। যদি তাৰপিছতো যদি আমাৰ লাগে যে আঘাতটো আৰু বেছি হৈ গৈছে, তেতিয়াহ'লে ডক্টৰৰ ওচৰত লৈ যোৱাটো বেছি ভাল।
All right. Thank you so much for calling at this point in time. I'm sure you must be benefited with the answer just the doctor gave you. So, doctor, we were talking about treatment process.
Yes. So, the treatment can be quite a few things. One is the commonest one that we use is the plasters. Okay. We can bring about very gradual correction without inflicting any kind of pain to the child with the help of plasters. And once we have corrected the things, we might maintain it throughout the child's life. Okay. At least throughout the child's childhood. So we can do that with the help of special kind of shoes that are comfortable and at the same time very effective. Okay. In some cases, of course, we might need the patient to undergo a bit of surgical procedures. Okay, but with today's high technicality surgeries, which employ quite a bit of expertise and cutting edge technologies, there is a very good rate of success in those cases. And we make sure that the child doesn't feel pain, because the last thing that we want to inflict the child is pain.
Actually, we are talking about children, we are talking about a child, so any parents would not like to see their child in pain. So these kind of treatment must have to undergo a bit of pain as well, and a lot of medicines would be also required. So are these medicines safe at this point in time to take for the children, and is there any kind of side effects also that child might have to go through?
Yes, that's right. So the medicines for pain that we give to the children, unless they are allergic to it, they are within the normal limits of risk that we might give them safely, and they will always be under doctor's consultation. No medicine should be given without a doctor's consultation or a prescription. That's right.
Okay. Now, if we are talking about children, we can't stop them from playing. They are full on with their activities as well. Yes. So, as we had a caller who was asking about his son, who had a good number of times he had a fall while playing. So, if we talk about such kind of like children, so if they fall down and they don't feel kind of pain and they don't cry also, how our parents will come to know that is my child okay or not?
That's a very good question. So children are, it is not that they don't feel pain, they don't respond to pain, okay?
They don't respond?
They don't respond to pain. Because if they do respond, they are very intelligent. If they do respond, then they will not be allowed to play.
Absolutely, yeah.
Okay.
They will not be allowed to do whatever activities they will be doing. Okay.
That's right. So what happens is that, in fact, maybe God also understands that, and He has made children very, very immune to all the pain and injuries. Whatever would have caused a big deal of trauma to an adult cannot cause anything to the child.
Okay.
So
Okay.
children are, by their virtue, very immune to all those pain and injuries.
Can we say that they have an inbuilt of resisting those kind of pains because these kind of talks also happens in between the families as well, that God has already sent children with a good of resistance, resist pain. So whenever they fall down, you don't have to worry that much that my child must be in pain, isn't it?
That's right.
All right, doctor, we have a caller, so let's take the call and we'll proceed with the conversation. Hello?
Hello?
Hello, আমি শুনি আছো, আপোনাৰ প্ৰশ্নটো কৰিব।
স্যার, মই সাইনৰ পৰা কৈছো।
হয় হয় কওক।
হেল্ল'। বাচ্চাবিলাকে যে পৰিলে যে কেতিয়াবা দুখ পায়, হৰত ভৰিত ধৰক মূৰত, আমি গৰম পানীৰে সেক দিব পাৰো নেকি?
যেতিয়া বাচ্চাই প্ৰথমতে পৰি যায় বা আঘাত পায়, তেতিয়া গৰম পানী ইউজ কৰিব নালাগে। প্ৰথমতে আমি ঠাণ্ডা পানী দিব পাৰি, আৰু নহ'লে বৰফ এটা টাৱেলত বা গামোচাত মেৰাই পেলাই দিব পাৰি। ডাইৰেক্ট বৰফ নিদিব, ডাইৰেক্ট বৰফ দিলে অকণমান ফ্ৰষ্ট বাইট বা অকণমান বেছিকৈ ঠাণ্ডা লাগি যাব পাৰে। এটা গামোচাত মেৰাই দিলে আপোনাৰ মিঠা এটা ঠাণ্ডা লাগি থাকিব। এইটো বাচ্চাটো শিশুৰ কাৰণে খুব ভালকৈ ধুনীয়াকৈ তাই ল'ব পাৰিব বা সি ল'ব পাৰিব, আৰু লাহে লাহে যিখিনি ফুলি যায় বা যিখিনি অকণমান বিষটো থাকে, সাধাৰণ বিষবিলাক কমি যাব তাতে।
হয় হয়।
All right, thank you so much for calling. So, doctor, we were talking about the pains which happens in children and the limitations, and we can't stop children from doing their activities as well. And we are having a good number of callers calling regarding the children, which they do a lot of kind of activities, but they fall down, and we never know that when they are in pain. So, is there a common medicine, or is there a precautionary kind of a medicine which can be given to children when they are in pain and we don't know if they are in pain?
So there are some.
If they fall down, and then
right.
I think our caller also mentioned about some arnica or something kind of like things. So this is one kind of medicine which has been given to children.
Yes. So we don't recommend giving them medicines without a doctor's consultation. If it has a required over-the-counter drug or any medication, that means that the child is in quite a bit of pain, and that means a consultation of a doctor is required. Otherwise, the thing that I just suggested just now, that a bit of cold compress for the first 72 hours will be a good enough thing for the to get the child back on his foot.
All right. So a lot of questions surfaced in everybody's mind, and whenever a parents come with a child and an infant, so a psychological structure is also to be looked upon, isn't it? So a psychological part is also to be looked upon, because a parent bringing an infant for a surgery or bringing an infant for a treatment, isn't it? So a lot of things goes in their mind. So will my child be cured or not? So at that point in time, as a doctor, what suggestions do you give to the parents so that they have that confidence on you?
Yes. So there are, whenever I see a child, there are three things to be done.
Okay.
One is making the rapport with the grandparents, because they always are right.
Okay.
One is counseling the parents regarding the technical things, and another to win the heart of a child.
Okay.
So winning the heart of a child is the most important, as I feel. And to win the heart of a child, you should be like a child yourself.
Okay.
So that's what we try to become. And regarding the technicalities, we discuss at length about the prospects of whatever procedure or plaster or whatever medicines we are giving. Okay, they entail just a bit of risk, but at the same time, they are going to make their children much better. So it is an informed decision that they take, and most of the cases, the parents don't have to repent that.
Okay. So after the surgery, you also give some precautionary measures to the parents to take care about when they take their child at home. So what are those, and what would you like to tell the viewers?
So we usually protect children with a plaster in most of the cases, because the children will run and play around, and they will, they won't regard their own surgery because they forget very easily. But at the same time, we protect them with a plaster. The plaster doesn't need to get soaked in water, And at the same time, regular medications are required. And if they find any red flag signs or any danger signs, they need to come back to us. That's all that is required. Children recover uneventfully most of the cases.
All right, and that was indeed a fruitful discussion, Doctor. Thank you so much for coming to Good Life, the Health Show. We are really short of time. We hope that we would like to do more discussion on this, but that's all at this point in time. So viewers, with this, we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. So if you have any queries, do join us next Saturday at 3:30 p.m. live. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.
Thank you very much.